So I know we've met you before, but can you just reintroduce yourself? So your name and your job title.
Okay. So I'm Anthony Batte. I'm a pediatrician, currently doing a pediatric nephrology fellowship here at McMaster. Back home, I'm a lecturer in the Department of Child Health and Development Center, working with Makerere University. And as part of my clinical work, I also work in Mulago Hospital, which is our main teaching hospital in the country, for Makerere University. Yeah, and as well, so as part of my work, I participate in treatment of children with kidney diseases. Yeah.
So that's pediatric nephrology.
Yeah, this pediatric nephrology.
Okay, cool. So you came to Canada to study through the IOP.
Yes.
How did that process begin? How did you join IOP? Why did you decide to join IOP?
Yeah, so IOP has first of all been working with Uganda for quite some time, and my first encounter with IOP was when I was doing my pediatric residency. During that time, I had an opportunity to come and do part of my residency here at McMaster, and then through my interaction and my work at the Department of Pediatrics, then I talked to the Department of Nephrology because I have had the interest in pediatric nephrology, who later accepted me to come back and do further training in pediatric nephrology.
Cool.
And so this is how I came.
And what do you think about the work the IOP does? Like, does it because IOP, you said, has been working in Uganda for a while. Can you see the difference in Uganda with like the help of the IOP?
So the IOP is one of the key groups that I've supported, that is together with McMaster, that has done a lot of work in training subspecialists in the different fields of medicine in Uganda. Right now, especially in the Department of Internal Medicine, many of the subspecialists that we have there, we are trained under the IOP program through McMaster. And even now, when I'm being trained as a pediatric nephrologist, right now in the university, we don't have a pediatric nephrologist who has been trained. So if I go back, then that is a big achievement, a big thing that as the IOP will have done for us as a country, and also as a university, and also in helping us, first not only in teaching, but also in managing the children with kidney diseases.
So if I understood correctly, when you go back to Uganda, you'll be the only pediatric nephrologist there?
Not in the whole country. So in the whole country, we have one pediatric nephrologist, who is currently not in our national referral hospital. So he's not part of our university and not teaching in the pediatric, the national referral hospital. So I'll be the only one in the national referral hospital currently. And we have that on addition to the pediatric nephrologist who we currently have in the country. Yeah.
So there'll be two, and you're saying it's good for the IOP to train you because when you go home, you'll be able to teach the students, and you'll be able to hopefully also inspire them to follow down the same path.
That's very right. Yes, so yeah, and also in the management of the patients, because now currently we are managing the children as general pediatricians in treating them for the kidney diseases that they have. So this gives us an opportunity to have more information, more skills and knowledge in management of renal diseases and management of these children. Yeah.
So when you mean management, do you mean more so like bringing children in for more regular checkups, so when they come and see you, it's not as serious as a problem? What do you mean by management of the diseases?
It just means so we have been running pediatric nephrology in Uganda, and we've been treating children, and at our hospital we've been doing that. But now when I'm trained as a pediatric nephrologist, or if we get even more people to train as pediatric nephrologists, now we are seeing these children as specialists in that field. So that means we give some extra, or we can be able to offer more specialized care to these children, because now we have more skills, we have more knowledge in the field of nephrology.
Gotcha.
Yeah.
is kidney problems in children a big issue in Uganda right now?
Yeah, so kidney problems are a big issue in the country. Just like in the general population, we know that generally we have renal diseases or kidney problems in children. Many can be born with renal defects that are born, and this is the general prevalence everywhere in globally. But then the issue with Uganda would be that as a developing nation, in addition to the general prevalence that we would expect even in the developed nations, we have problems like HIV, which as a virus it affects the children and affects the kidneys. Then the drugs that we use affect the kidneys. Then we have infections, which are more prevalent because we have more infectious diseases in the tropics and developing countries. These again worsen the burden of kidney diseases that we see. Currently, because we don't have this field well developed, we don't even have the clear statistics to use when assessing how the magnitude of the problem. Yeah, and so we believe that as we develop this field, pediatric nephrology, now we can be able to do even studies, assess the magnitude from a more informed point of view, and be able to quantify the problem of pediatric nephrology in Uganda.
Is that going to be one of your jobs when you get home? Are you kind of going to be leading the charge of that study?
Yeah, I think that is my one of the things that I see as past this training. So after the training, after getting this is one of the things that I think will be very important, and I will be doing research and clinical care.
And you said you're going to be teaching when you get back as well.
Yeah,
right?
yeah. So formally, I'm employed by the university as to teach.
Makerere, right?
Makerere University, and so even when I go back, this is part of my duty as a university staff to teach the students, both undergraduates and postgraduate students who are specializing in pediatrics.
Okay, cool. Mm-hmm. Anything else? What else do you think we need to?
Trying to think here.
What other things do you learn in Canada? Like you're learning like your specialty, pediatric nephrology. Like even just like, are you in lectures when you're here? Like do you go to like classes and stuff?
Yeah. So interestingly, training at a subspecialty level is slightly different from training from a lower level, because right now my role is to see patients. So I have a licensing, the Canadian Association for Doctors, which we call the CPSO, gave me a license to practice, to treat under supervision. So here I do the treatment of the children with kidney diseases. Then I work with these staff who are supervising me as I do this. I keep learning. So I don't really get formal lectures. Occasionally we can have some of those, but the main thing is to do the practice itself and learn as you do. So I work as I learn.
So I think that's you mentioned the license that you have. I
Yes.
think that's something very specific to the IOP.
Yeah.
Not a lot of programs do that. So with
That's
that
very
license,
important.
are you allowed in Canada to take part in like all active duties that you would back home in Uganda?
Yeah, so that's very important about the IOP. So pretty many times we have what we call observerships, and that's the commonest way in which a person from a developing country would come to practice in Canada. You just observe as others do, and then you learn from there. The special part of the IOP and the fellowship is that what I'm doing, I do the work. So I treat, I do everything the same way anyone who would be at my level of training in Canada would be doing. So I get licensed to do what any person who is doing a fellowship in that field is doing.
So
Which is not just observing.
For example, if you see one of your patients, you could prescribe them their medication.
Yes, so I do prescribe. I have a prescribing number, so I can make orders, provided they are reviewed by my supervisors. They go to a pharmacy with that order, my name, they get the drugs.
How does pediatric nephrology different in Canada than it does to Uganda? As I know you said it's more developed here.
Yeah.
But is there any differences like that you see?
So pediatric nephrology as a field shouldn't differ. So it's much of what the difference is what is offered here that may not be offered in Uganda, or that is not offered in our country. So, and those are the some of the differences that usually arise. Otherwise, the practice of pediatric nephrology is the same. You treat and you study and you learn all this. The issue is sometimes some services you may not be able to offer them in Uganda, or in some cases when you may, so you may not be able just to offer them. I think that's what I would say. But
so when you get back, you said you're going to teach, and you're going to would growing nephrology, like pediatric nephrology, be like another goal to like try and bring it up, to try and get all the services that you can get in Canada offered in Uganda?
I beg your pardon on that?
So you said pediatric nephrology shouldn't differ no matter where it is in the world.
Yeah.
But you also said that Canada can offer services that right now you can't in Uganda.
That's right.
So your goal upon returning home, would that be to get Uganda to the point where it can offer all the services that Canada can offer right now?
Yeah, so that's very important. Yeah, that's right. So as I go back as a specialist in renal diseases or as a nephrologist, my role would be now, now that I've acquired skills that a Canadian nephrologist has, so I should be able to move up and offer the services that should be offered. So that should be my goal, and that's precisely my goal. Then now as I go back, it is to try to bring these two together, the idea that I have the skills to offer this and what's available. So depending on any given setting, because even in the same country we have different abilities depending sometimes even on a given patient. So you may be in a government hospital, resource limited. In that case, sometimes you won't be able to offer the dialysis or hemodialysis. But in the same country, there are some places, a given hospital where they have the equipment. So meaning that when I go back, I should be able to work in those two places. But as well, even in the resource limited setting, to be able to bring up to a given level, to bring up the services, to at least optimize what we have. I think that's the best word, to optimize what we have, even in the setting of limited resources.
I think, like, just listening to you now, you can kind of see the full circle of like what the IOP does. So you got your as much training as you could get in Uganda. You came to Canada with the IOP, and you learn like the services that you can offer. And now that you're going to be a specialist, when you go back and you're teaching your students, you can teach them what you learn in Canada, and then can you teach them to be specialists now?
So that is important. One, so even now when I'm going to teach, this is another important part or aspect of the IOP, that it brings you to the developed country where everything is offered. Because part of the teaching shouldn't be that you should be taught on the resource limited services available. So now I'm able to teach with a student that this can be done this way, only that we don't have this resource here, right? So then train them that at that level. Then the second aspect is, can I now train specialists, right, in nephrology? That I can, but we still need teams. So I don't think I can do that as a single person. Right now we've said we have 2 nephrologists in the country. We still need more training, more people. So we need still to get more people on board and more people be trained in nephrology, because if you're teams, then much of the work is easier. You are able to develop the field, right? So I can't say that I can do it alone, but we still need more capacity development. I can still do the training, but we still need more teams. We need to be having more teams. Yeah.
So you're going to be trying to put teams together when you get back there?
Putting teams together, and even still advocate for more training for many of my colleagues, such that I don't work as one individual. I think it is harder that way. Yeah.
Oh, everything's easier when you have a big team of people to go
That's
about
right.
it. and you'll be able to teach more. You'll be able to continue your continue to grow your field.
That's right.
Yeah, that'll be good.
Mm-hmm.
I think. Anything else you need to add to that?
No, I think that was good.
Do you have anything
Yeah.
else you think you need to add?
Anything you want to say?
Anything? I think I think first because I've been with the IOP at different levels. I've been under the IOP as a resident to just come here to rotate. Then I've now again come back under the IOP still for training as a sub-specialist. My thing is I think we as a country, as Uganda, we need to acknowledge the importance of what the IOP has done to our country, because I think some of these things, like the trainings that we get, are very key to first the health system in Uganda, and I believe still whether the government can afford or cannot afford, what we know is the government has not been able to do this, and these are expensive ventures. Bringing a person from Uganda like me, come to Canada, get residency, where to stay, pay for accommodation, pay for my licensing by the organizations, this Canadian Physicians and Surgeons of Ontario licensing, pay for my insurance as a health worker. I think these are big ventures which the IOP has started to take on. And I think they are very important, and they are helping our health system. Like I said, many of the sub-specialists that we are having in the country are trained under this same program, and it has continued to grow. Even if it's not bringing sub-specialists, when we come as residents, I came here as a resident, even if I didn't get a certificate and it was just an exposure for 3 months, this was very important that when I go back home, I'm not the same, right? So the practice of medicine changes. When we are training, we're always seeing improvising, training in a resource-limited setting. When you come here, then you see training or medicine in a resourced setting, well-resourced setting. That exposure alone is very important, that even if you go 1 or 2 people keep doing that, it changes our culture of practice of medicine. It changes our exposure. So now, even if I hadn't come back, how I train students on the wards on how to care for patients is different, because I have this other background of Canadian training. So I think these are all important aspects that IOP has done.
So you think the IOP is something you're going to stay involved with or a part of, like even after you're back home?
Yeah.
Like something you'll recommend your students to look into, like come and study?
Yeah, so IOP, I would continue to work with it, and even helping students to come and advising them, and even if it meant fundraising for IOP. I think these are very important and key organs or structures that are supporting our healthcare in such a significant way that you can't just afford to lose. And even if you need to commit either resources or give manpower in any form, you would be so interested to give. And I believe if there's anywhere our government could even work together with the IOP, such that either it just adds on to what the IOP is doing, this would have been very important and significant steps to improve healthcare in Uganda.
Perfect.
Yeah.
Nice.
Beauties.
Thank you.